Good morning, everyone. Thank you so much for joining us today at the Autism Research Coalition. Today, we're very fortunate to have Dr. Stein with us from Great Plain Labs. Good morning, Dr. Stein.
Good morning, Jessica, or afternoon. Where are you, on the West Coast?
Oh, sorry. I'm on the West Coast. So
Okay, yes. All right. So good morning to you.
Yeah, exactly. I'm just going to give a little bit of your background, and then you feel free to take away with your presentation.
All right.
So, Dr. Stein is responsible for science and clinical translational research, including laboratory-developed tests at Great Plain Labs. His first project has been the improvement and validation of the mycotoxin profile, which tests for 18 analytes in 40 mold species. He's interested in understanding root causes of disease and providing the best testing available to help guide practitioners and their patients in their healthcare journey. Today, we're going to discuss the impact of mycotoxins and mold in human health and their correlation with disease, specifically autism, hopefully. So please take it away.
Okay. Well, thank you, Jessica, and Enrique, who's behind the scenes there. So it's a pleasure to speak to your audience at the Autism Research Coalition. I did want to start out by saying I was recently fortunate to be at the Weston A. Price Foundation conference, as well as the Children's Health Defense. And of course, there were so many people interested in autism there, and it was such a pleasure meeting them. Of course, working at Great Plains, I've had the pleasure of working with Bill Shaw, who is one of the leading researchers in trying to understand the root causes of autism and getting to better testing. So it's really been an honor and a pleasure to work with him. And he still is with Great Plains as our in-house scientific advisor. So while he is semi-retired, he is by no means gone. So that is an introduction. Let's move on. And I think, as many people in this audience know, that mold has been with us since the time of the ancients. It's actually mentioned in the Bible as one of the plagues that one might identify in one's living quarters. And of course, segueing to the modern day, we know that mold can grow in various spaces, particularly where it's very wet or humid. And you really have to go to extreme measures to remove the contaminated materials, clean. Otherwise, you're going to have all sorts of mold-related illnesses and complications. So I'd like to start out actually by clarifying what I think is sometimes confusing to people, and that is, what actually is the difference between yeast, fungi, mold, mycotoxins? All these terms, I think, need definition so that we can understand what we're talking about. Yeast is certainly a subset of the kingdom of fungi. We think of it in terms of what we use to brew beer. It's certainly ubiquitous in our environment. It colonizes our skin and our GI tract. But typically, it's very benign, and it lives with us and among us and doesn't do anything unless our immune system becomes dysregulated, and at which point it can become invasive and highly toxic. Aspergillus is an example of a species of fungi, but is not a yeast. Very common in humid or wet environments. Again, typically it's kept in check by our intact immune system. And of course, within our GI tract, it's in competition with our normal biota. However, it can colonize the GI tract and ultimately cause disease if our immune system and our normal flora become dysregulated. We call that dysbiosis. So then you can get overgrowth of Aspergillus. Mold is a general term of fungi that's growing not on the body, but on some other organic substrate. And typically that's in a wet human environment. It colonizes food sources, which can actually be our food. So that could be grains, it could be nuts, or that could be cellulose containing building materials from a house. And if it grows enough, I mean, we've all seen mold in the refrigerator on food, and it can be black or blue or red or yellow. When we see mold, we certainly know what it looks like. Now, I think very importantly, we need to recognize that mold can jump from the environment and can actually colonize us if we're in a susceptible situation. So it can colonize those wet, warm places in the body. So that can be the lungs, our nasal passages, the sinuses, and as I'll show you later on, even the GI tract. And lastly, mycotoxins are not fungi or mold, but they're the toxins that are released by the fungi. And it's important to keep in mind that these are fat soluble, and therefore they can be stored within the body if we absorb them, and they can present an ongoing problem. So again, mycotoxins, they come from two places, either contaminated foodstuffs, various types of grains, nuts, even interestingly, grapes, things of that sort. You can have contaminated food, and through that, you can take it in. Alternatively, as I mentioned, you can have wet building syndrome, where you typically, it may be black mold, but not only. And there, if you are in that area, even if it's behind drywall, it's going to elaborate some of those fungi, and we can get exposure via inhalation, and the fungi itself can actually colonize, again, these wet, warm, inviting spaces, and they can be elaborating the mycotoxins as well. So it can be through direct exposure that we're getting the mycotoxins, or because these fungi, these pathogenic fungi, have set up housekeeping within our body, and they're therefore secreting these mycotoxins. And ultimately, when it comes to detection, the most common way is to get a urine sample. The body is continuously clearing us of all toxins, including mycotoxins, and then we analyze that by whatever biochemical or chemical method that the laboratory has developed. So mycotoxins are among the most prevalent toxins in the environment. It's important to keep in mind they are very toxic. Fortunately, they're usually uncommon, but in certain situations, they can certainly affect the individual. They can, again, be affecting foodstuffs, buildings. Keep in mind also vehicles. How many times have you had a flooded vehicle? You have to beware of mold growing. In the EU, it's been established that in terms of the grains harvested, 20% or more are contaminated with mycotoxins. And for certain ones, such as the zearalenone, this is a huge public health issue. So I'll go into that a little bit later. Unfortunately, mycotoxins are not like bacteria or yeast or fungi in that you can kill them off with heat or a little bit of disinfectant. They're very resistant to heat and many processing procedures. So it's really more about stopping exposure and removing them from your body. You can't really deactivate them. So what are some of the common mycotoxins that we test in urine? Well, there's aflatoxin M1, ochratoxin A, stromatocystin, citrinin, gliotoxin, roridan E, urocarin A, eniatin B, zearalenone, mycophenolic acid, and chitoglobocin A. This is the current assay that we offer through Great Plains Laboratory. Some of the other labs in this functional medicine space offer similar panels with some variety, but they're all basically in these categories. So the most common mycotoxin is called ochratoxin A. This is typical of the mycotoxins. And what you see are these polyphenol rings. It's a polycyclic hydrocarbon. Almost always there is an epoxide molecule as well. So this is very common. And as you can see, it's both polar organic. So it's not pure fat loving, but it is fat loving enough to take up residence in your adipose tissues. So again, typical of mycotoxins, this is very common in food and water damaged buildings. It is toxic to the body, particularly to the kidneys. It can cause immunosuppression. It's carcinogenic in that it makes complexes with the DNA and causes mutations to occur. There are neurologic associated symptoms. For reasons unknown, it appears to be more toxic in men than women. And it's by far the most common mycotoxin that we pick up in about 70% of our samples. But of course, I have to make a caveat there, and that we have ascertainment bias, and that people are sending us samples to actually find mycotoxins, but we do find it very frequently. Another very important one is roridan E, which is in the macrocyclic trichothecene class. Again, this comes from mold from water damaged buildings or food. Interestingly, this is so toxic, it's been used in the past for biological warfare, so you don't want to get a big dose of this. It certainly causes neurologic damage, immune suppression. Like a lot of the mycotoxins, it's also an endocrine disruptor, and it can cause gastrointestinal symptoms. Stromatocystin, again, water damaged buildings and food. It has a structure very similar to the aflatoxins, which I'll get to in a minute, which are super carcinogenic. It's toxic to the liver, the kidneys, the immune systems, and the lungs. And all of the mycotoxins will drain your glutathione pool, but particularly stromatocystin will do that. The aflatoxins mainly come from food sources, more toxic in children than adults. It's well known as being a primary cause of liver cancer in certain places where it's endemic, particularly in China. It is the most common cause of liver cancer. It can cause mental impairment, abdominal pain. It suppresses leukocyte function and number. You can have neurologic symptoms, including headaches. And of course, if it affects your liver enough, you can become jaundiced. Eniatin is a little bit different. It's a cyclic peptide instead of a macrocyclic molecule. Also a food contaminant, ends up with fatigue and weight loss, also liver disease, known to directly suppress mitochondrial function. And very interestingly, it seems to alter bone remodeling. Zearalenone, in my opinion, is really, I should caveat by saying I'm actually trained as an endocrinologist, but I find zearalenone particularly interesting because it is a xenoestrogen. It is an estrogen mimetic. So again, you can see the phenyl ring here. You can have the epoxide. And this actually activates the estrogen receptor, and certain metabolites of zearalenone are actually more potent at the estrogen receptor than estrogen itself. So you can imagine that that has a lot of downstream effects. So this comes typically from food contamination. I mentioned it seems to be more common in Europe and I guess also the Middle East and Asia. Being a potent estrogen, you can get hyperestrogenic side effects. So you can have premature puberty, you can have precocious puberty. It can result in miscarriages of various kind. It can impair fertility. You can have dysfunctional uterine bleeding, all sorts of things. You can have breast tenderness, all the things that we associate with hyperestrogenic states. And very interestingly, it seems to be able to affect fertility of the following generation, which is a whole other fascinating topic, probably related to the epigenetics of the sperm and the egg. It can result in thymus atrophy and therefore immune suppression as well. So the last member I'd like to just mention is gliotoxin. This is a class of secondary fungal metabolites characterized by a special type of piperazine ring. It interacts with DNA and also can cause double strand breaks and therefore can induce mutations, which is seen in a dose and a time-dependent manner. And I think what's really interesting about gliotoxin is that in contrast to the other mycotoxins, which seem to come from more of these bad toxins that are coming from water-damaged buildings and from food, you can actually elaborate gliotoxin from sort of endemic colonized candida within the gut when you have candidal overgrowth. So like the others, it's immunosuppressive, but you can actually look at women who have severe vaginal candidiasis, and you can see significant elevations in gliotoxin. So, so in contrast, when we worry about some things about yeast overgrowth and their relationship to dysbiosis and potentially biochemical changes that predispose to autism, gliotoxin in and of itself can be coming from yeast overgrowth. Mycophenolic acid is very interesting. It comes from the Penicillium strain of fungus. It's very, very immunosuppressant, and it inhibits the proliferation of B and T cells. And interestingly, it is the basis upon which the pharmaceutical industry has made the immunosuppressants for organ transplants, such drugs as Cellcept and Myfortic. But being a sort of environmental mycotoxin immunosuppressant, as you would expect, this and the other immunosuppressant mycotoxins put you at greater risk for opportunistic infections if you should otherwise be vulnerable. And we can discuss, what are these other environmental insults that we can be exposed to. But there can be overgrowth of Clostridia and Candida, as well as tick-borne relapsing fevers, in particular Lyme. So all of these sort of come together, these fellow travelers. It's associated with miscarriages and congenital malformations if the woman's been exposed during pregnancy. And very interestingly, all the current assays cannot measure mycophenolic acid if you're actually on the drug at the current time. So I'll have more to say about that later on. So just to make the point that I can say Aspergillus, but Aspergillus is a whole family of fungi. So there's Aspergillus ochreus or carbonarius or nigellus or versicolor. And while some of these subfamilies will produce mostly ochratoxin A, some will produce strigometacystin. And the other way to think about these mycotoxins is, while ochratoxin A is predominantly found by secretion from Aspergillus, it can also be secreted by Penicillium species. So it's a little bit confusing. So one can break it down in terms of the fungi that seem to colonize people and cause disease, and also the mycotoxins that they elaborate. So there is some overlap there, and you get a general sense of what the fungal criminal is, if you will, but there may be some overlap. So what are mold exposure symptoms? And I think it's important to differentiate that's which are allergic versus those which are systemically toxic. So we all know people who can go into a dusty room where there must be dust mites or other types of mold, and they immediately have sort of bronchopulmonary symptoms. They may get a runny nose, congestion, cough. That tends to be IgE mediated. So that tends to be really very, very quick. The systemic toxicity tends to be more cryptic and sort of creep up over time. This is, again, due to the mycotoxins, and it's not an allergy. And we get a myriad of symptoms: neurologic, endocrine disruption, cardiovascular. There's associated with the neurologic symptoms. There could be psychiatric symptoms. We can have severe gastrointestinal distress. And for some of them, like T2 toxin, even bleeding. So how do you treat exposure to mycotoxins? Well, as you would expect, first and foremost, you have to remove the environmental source, be it contamination, the wet damaged building, the black mold. It's very important to realize what could be behind the wall. There could be leaking pipes. If you're in an apartment or in a house, it's above or below you, and it may be somewhere else, and it's going into the HVAC system. And again, it could be contaminated food. Could be grains in particular. I note that in the news recently, there's all sorts of trouble moving foodstuffs down the Mississippi River on the barge traffic due to the low water levels. And they're literally piling up these beans on the banks of the Mississippi. And you can imagine if they get wet, that's just, perfect scenario to be growing these molds. So I would be very careful, what we order and eat in terms of beans over this next year. So antifungal drugs and supplements are very important. We'll go into a little bit more about that later. Obviously, detoxing can be assisted with glutathione, and I'm sure everybody has their favorite approach to high bioavailability glutathione. Binders are important, activated charcoal and various bentonite-type clays. Chlorophyll is a good binder. Cholestyramine I'll mention a little bit farther on. And also probiotics, which by enhancing the normal, if you will, yeast in the gut, will outcompete the pathogenic fungi and help to reestablish a normal microbiome and normal biosis instead of dysbiosis. So you're basically outcompeting them. And chlorella can as well. So in terms of cholestyramine, this is a drug that's used obviously for high cholesterol, but it's very good at binding up fat-soluble molecules. Typically, it's 4 grams twice a day with food. The way it works is by binding up these fat-soluble molecules in the gut. You reduce enterohepatic circulation of the bile salts, which in turn can be bound to the mycotoxins. And it may bind some of the mycotoxins directly. And because you're binding up the bile salts, they're just being eliminated in your feces and they can't recirculate. So again, other options can be binding bentonite clay or charcoal. So here's a very, very interesting case report from about 10 years ago. A family that moved into a rental house that clearly was water damaged, and they had all sorts of dramatic symptoms. They were a family of 5, and they had a pet dog, and every single person there, including the dog, was very highly affected. So this was, they had the mother of the house was pregnant at the time and she gave birth. And then within a few months, this is the child, had this very distinctive erythematous blanching rash with other associated symptoms. But as I mentioned, everybody else was symptomatic. They were previously in good health, and the father, age 40, he had cough with phlegm, irritated throat, headaches, sinusitis, fatigue. He had neurologic symptoms. He was somnolent. He couldn't concentrate, sort of real brain fog, decreased libido, had some mucosal bleeding. His hair started falling out, and he was wheezing with shortness of breath. So again, here's a listing of all the other neurologic symptoms and psychiatric symptoms that he had, which were really quite profound for an otherwise perfectly healthy person before this whole started. So everything from coordination to complex motor skills and the sensory, vision and smell, a lot of things going on. So the mother, again, who was very healthy before, she also had these upper respiratory symptoms, phlegm, throat irritation, headache, sinusitis, again, very fatigued and somnolent, again, having some neurologic problems with short and long-term memory loss, not surprisingly, also with a decrease in libido, and also with pulmonary system symptoms with shortness of breath and wheezing. The older son, age 5, also very affected with headaches, fatigue and tiredness, again, upper respiratory, congestion, nosebleeds, throat irritation, wheezing, and not surprisingly couldn't pay any attention in class. So they identified that this was probably a water-damaged building, and there was mold. So they checked all sorts of biofluids and tissue specimens from everybody in the family, including the dog, I might mention. So everybody was positive. So predominantly for ochratoxin, but there was even some aflatoxins, some of the other trichothines. So really wherever they looked, they ended up getting remarkably high levels of mycotoxins. And the mother, who was pregnant, gave birth, and they determined that their mycotoxins was in her breast milk. So that implies that it was getting into her body and then being excreted in the breast milk. It was in her placenta and in the umbilical cord. It was, well, here they didn't do the newborn's urine. But there were some other places where they checked and they found it. And the dog had all sorts of rashes and masses, and everywhere they looked in the dog was affected as well. So the dog was just as vulnerable. So one of the very interesting tests of neurologic function that is sometimes used if we suspect mycotoxin exposure with neurologic deficits is something called the visual contrast sensitivity test. And this is a subtle sort of grid pattern going left, straight up, or right. And it gets subsequently fainter and fainter and fainter on the screen. And your ability to perceive the correct direction at which this grid is going is a measure of the intactness of your retina and your retinal processing system. And that in turn, of course, is a readout of how well your neurology is working. So this was originally developed by the Department of Defense to assess the acuity of pilots' vision, but ultimately it was realized that this is a great window into neurologic intactness, and it's now accepted that this is a very sensitive test to detect either biotoxin exposures or nutritional deficiencies. And this has been shown to be abnormal not only with mold exposure, but really other biotoxins. So volatile organic compounds, heavy metals such as mercury or lead, various venomous insect or animal bites, and not surprisingly also Lyme disease and associated other tick-borne illnesses. So getting back to the risks of these mycotoxins, when we think of hepatocellular carcinoma, the major risk factor everybody thinks about is hepatitis B. Being an endocrinologist, I always, pipe in that, well, you can also have fatty liver and non-alcoholic steatohepatitis. That certainly is a risk. But the other tremendous risk that we now recognize is that of aflatoxin exposure. Aflatoxin induces nucleotide substitutions in a tumor suppressor gene, P53. So that induces a mutation, and this can be present in up to 50% of patients with hepatocellular carcinoma. And that's seen particularly in areas where there is high exposure to aflatoxin B1, particularly in China. So what's amazing and really shocking is the fact that compared to people who don't have hepatitis B and are not exposed to aflatoxin, your risk of hepatocellular carcinoma goes up by 60-fold. It's really extraordinary. So very important to know, and also identify other risk factors, i.e., are you hepatitis B positive, or do you have steatohepatitis from metabolic syndrome? So we know the mycotoxins take up residency in neurons of the CNS. It's directly neuronal toxic. Here's a in vitro study showing that particularly the hippocampus is particularly vulnerable to ochratoxin A. And this was a very interesting case report that I got from Bill Shaw, showing that aspergillosis, again, can colonize the individual. And we tend to think of systemic or metastatic, if you will, aspergillosis as colonizing the lungs and then causing systemic, sepsis and just sort of overwhelming infection and death. But this was a case of two individuals who came to autopsy, and it was found that the only place that they could find the aspergillosis was in the GI tract as the primary site of infection. So again, when the GI tract is not exhibiting normal flora and with an attacked immune system, the aspergillosis can take up residence and be invasive from the gut itself. And here you can just see the Aspergillus hyphae in the intestinal wall. So because you can inhale the mycotoxins, they can go to the CNS. And these mycotoxins, again, being lipid soluble, they can migrate into the brain. And this can be an unrecognizable and treatable, reversible cause of early Alzheimer's disease. And I think the most exciting and advanced investigator in this field is Dr. Dale Bredesen out, I believe he's at UCLA or at USC, I'm sorry, these days. And he's currently doing the DECODE project, looking at multiple reversible causes of declines in neurocognition. So that'd be everything from vitamin deficiencies, particularly those impacting methylation pathways, heavy metal toxicities, but also mycotoxin exposure. So he reported on a case of a woman who was otherwise in good health in her 60s, who started showing neurocognitive decline. Her MRI showed cerebral atrophy, and she had an amyloid PET scan, which was positive, indicating that that was Alzheimer's disease. So she was just in the early stages. And it seemed that her symptoms would always worsen whenever she would come home from travel, which was really a very interesting point. They evaluated her home and they isolated Stachybotrys, so-called black mold, penicillium, aspergillus. All of these are associated with neurotoxin production. So they obviously got her out of the house. They treated her with anti-mold therapy, and she began to show some improvement, which was in stark contrast to the very severe decline she'd seen over 2 years. So currently, Dr. Bredesen and his colleagues is embarking on a very large randomized control study of these multiple lifestyle interventions, including looking for mold and treating mold in the patients with early and preclinical Alzheimer's disease. So we're all very interested to see what he's going to find. And I should mention that he's partnering with Great Plains on that study. So one of the things that Dr. Shaw really pioneered was the use of another test that Great Plains offers, which is the organic acid test, otherwise known as the OAT. And the OAT tells a lot about one's vitamin and mineral sufficiency, if you will, but also can tell us a lot due to the organic acids that are produced by, if you will, dysbiotic species. So that could be yeast on the one hand, it could be Clostridia species, bacteria on the other, and it can also be fungi, particularly Aspergillus. So I just wanted to go through that because there is a role for organic acid testing in conjunction with mycotoxin testing. So the sine qua non of the organic acid markers for Aspergillus are the so-called furan family. There's 3 main ones. I'm not going to bore you with the actual names. They're actually very difficult to pronounce, but you can see them on the screen. But they're all marked by this sort of furan ring. slight differences, and but all of them are quite unique and quite specific for Aspergillus that's colonized the gut. So these are just some of the references to support that. So some studies over the last number of years by Dr. Shaw and his colleagues showed that in patients with known gastrointestinal mold overgrowth, they were looking at two of these furoic acid species, and for those who were mycotoxin positive, very distinctly higher levels of the furoic acid organic acids. And in contrast, when they looked at those who were exposed to mycotoxins versus healthy controls, they could see that, and again, these are those who have these furoic acid markers, a number of mycotoxins were significantly elevated, and that included aflatoxin. Again, ochratoxin A is the most common, and although less common, we still saw strigomatocystin, zearalenone, Roridin, and verrucocarin, not so much eniatin B. So the mycotoxins, as I mentioned, are neurotoxic, so they seem to be associated with neurodegenerative disease, Alzheimer's, Parkinson's. They also seem to be influencing cognition, depression. And the last thing that they're associated with is sporadic amyotrophic lateral sclerosis. And this is a unfortunately progressive and fatal disease. It tends to progress over 3 to 5 years. And while a minority are due to genetic mutations, the majority are polygenic. So it's been found that epidemiologically, that sporadic amyotrophic lateral sclerosis, ALS, is associated with clear contamination of grass and well water with ochratoxin, as well as, well, I should say with Aspergillus and other ochratoxin secreting species. And this was a very interesting case that came to autopsy, somebody with amyotrophic lateral sclerosis. And what they found was when they actually looked at the brain of this individual that it was chock full of mycotoxins there as well. So here's somebody who came to Great Plains Laboratory with ALS, a young man, which is unfortunately the typical age group for ALS. We can see that the ochratoxin A was beyond the 95th percentile. Strigomatocystin was 100 times the upper limit of normal. And eniatin B, which again is very rare. We very rarely see this. And this was about 1.5 the upper range. So in addition, the organic acid test showed these furoic acid markers, again, implicating Aspergillus. So I just wanted to say a few words about autism because I know this audience is particularly interested in that. As I think Enrique and Jessica may have mentioned, I had the pleasure of going to the Weston A. Price Foundation conference and the Children's Health Defense. And I have my new best friend, Patricia Lemmer, which I think some of you know, who is one of the leading lights of autism research. And it was such a pleasure meeting her and talking to her and really just picking her brains. And I could already see that, you know, she and I think exactly alike, that one has to think about total toxic burdens in the body in terms of susceptibility to autism. There may be certain genetic predispositions, but a lot are cumulative epigenetic changes due to diet, toxic exposures, metals, pesticides, etc., allergies from the gut and a leaky gut that can certainly overwhelm the body's ability to maintain a gut barrier and a blood-brain barrier and to keep our brains healthy. So this was a study done by DeSantis and colleagues out of Italy, and they looked at the frequency of mycotoxins in children with and without autism, and they had an excellent control population. These were the brothers and sisters and the parents of the children with autism, and just looked at their mycotoxin load, and it was significantly elevated in those. And what they found was that both cytokines as well as IgG to food and the fungal toxins were much higher in those with autism. And the degree of mycotoxins in both the urine, and they also tested blood, was significantly higher in those with autism as compared to the control population. Well, if there's a relationship between fungus colonizing you and elaborating mycotoxins, which can have neurotoxic effects, and if these are potentially associated with risk or progression or worsening of autism, would you be able to detect that, and would you be able to reverse it? So those, of course, are the $64,000 questions. And this study was done by our own Dr. Shaw and some of his colleagues, including Dr. Chaves. And again, looking at the OAT test, they looked at these feroic acid species and looking at normal control males versus autistic males of the same age range. The feroic acid species were much higher in those with autism. And then they looked at the effect of nystatin, which is a really mild antifungal. It's only modestly effective in treating Aspergillus, but nonetheless, they showed between a 21 and a 63% reduction in the markers of the organic acids that are produced by Aspergillus. So this was another case, 4-year-old individual. Unfortunately, I don't have listed whether it's a male or a female, but given the prevalence, probably statistically, this was a young boy. And here you can see the 5-hydroxymethyl-2-feroic acid was 46 times the upper limit of normal. The furan 2,5-dicarboxylic acid, 44 times the upper limit. And arabinose was also very, very high, almost 4 times elevated. And that actually is not directly related to Aspergillus, but is related to yeast. So that implied that this boy had a very dysbiotic gut. And there was a lot of yeast overgrowth in addition to Aspergillus colonization and overgrowth. So some of the other markers were very high oxalic acid. This is very important because this can inhibit dopamine beta hydroxylase and has important feedback effects on the tryptophan kynurenic quinolytic acid pathway, which can have neuroexcitatory effects on the brain. And this may be part of the reasons why autistic children are acting out. There are many reasons, but this may be one of them. So this was clearly evidenced in the organic acid test. So when they looked for the mycotoxins, his ochratoxin A was very significantly elevated. So one of the most famous cases that Bill Shaw is always fond of presenting, because this really shows the fact that autism, while it may have some genetic precedence, is in many instances, at least partially environmentally influenced. And this was a case of a young child who had autism spectrum disorder, clearly had Aspergillus, and then was treated with itraconazole and Sporanox, which is basically just the non-generic form of itraconazole, and who had an absolutely dramatic and rapid recovery. So in this child, if you look at the feroic acid species, after just a month worth of treatment, they had most of them 90+% reduction. And in terms of arabinose, which again is related to the yeast overgrowth, reduction in 66%. So itraconazole really is the preferred treatment as compared to nystatin, or even, I think I have a later slide, fluconazole. So this was the fastest recorded recovery from autism ever recovered over the course of just 6 weeks. This little boy had a severe Herxheimer reaction, resulting to presumably the die-off of all the Aspergillus and the yeast. Itraconazole works somewhat better than as the Sporanox than the generic. If this is the quality control, we don't know. This might be one case. If it was my child, I probably would want to use the non-generic. And they used a fairly large dose, up to 500 milligrams per day for a small child. But this is pretty safe in most individuals. Only about 1 to 50 children have to be taken off due to elevations in their liver function test. And as long as they're monitored on a routine basis, it should be very safe. So the advantages of combining an organic acid and mycotoxic testing is that the most common mold species, Aspergillus, can be identified with the 3 furan compounds. Almost 100% of positive urine samples for these furans on the oat are also positive for ochratoxin A by the mycotoxin test. So they really are complementary tests. If the furan test is positive, that implies these Aspergillus elaborated organic acids are being absorbed from the gut. So the gut is colonized with Aspergillus and therefore would likely be responsive to aggressive antifungal therapy. Now, if you don't have positive furans, that doesn't rule out other molds and mycotoxins, just that you're probably not dealing with Aspergillus. So you can follow success by measuring either the mycotoxins or the furans. As I'm sure many in this audience appreciate, there are various effective herbal remedies as well as pharma drugs like itraconazole, Sporanox. So it should be kept in mind that you can treat colonization from the gut, but if you're still exposed, that's not going to help you. So if you're still in a toxic environment where you're breathing it in, you can still have it. If you still have a dysbiotic gut, you can still be recolonized and you sort of go around in circles. So it's important to identify other toxins and to try to promote a healthy gut to reestablish equilibrium and keep the bad guys out. So, okay, so what drugs do we use? Again, this is just making the point, itraconazole is the drug of choice for treatment of Aspergillus infections. So the usual adult dose, as recommended by the Infectious Disease Society of America for aspergilloma, so that's this big fungus ball in your lungs, that's about as worse as it gets. So a loading dose followed by 200 milligrams twice a day, treating for at least 3 months and until clinical and lab measures of active infection have resolved. But again, you can also use it when it's not life-threatening. And if we just know that you have been colonized with Aspergillus, this is absolutely the best drug to use. And it's certainly safe and effective in immunocompromised and non-immunocompromised patients who are intolerant or have no response to that very highly toxic drug, amphotericin B. So it actually is the drug of choice, although I think your traditional infectious disease specialist would recommend amphotericin B. For pediatric thrush, the dose is 2.5 mg per kilogram twice a day. There's an oral solution you can get. Okay, so summary, the combination of these tests, organic acids and mycotoxins, shine a bright light on some of the neuropsychiatric diseases that exist, including autism, ALS, depression, neurodegenerative diseases like Alzheimer's, Parkinson's, and I didn't mention it, but even fibromyalgia. Most common markers of Aspergillus species indicate likely colonization, and they can be found on the organic acid test, whereas the MycoTOX profile checks for common Aspergillus mycotoxins as well as other mycotoxins that one can become exposed to due to food or the environment. So I just want to talk a little bit about our new test and again, reiterate why mycotoxins are relevant and how they might be harming us. So the severity can be determined by multiple factors, as you might expect. The duration and the dose of exposure is important. The type of mycotoxin, some are very highly toxic in small amounts, some are just moderately toxic, but over a prolonged term can cause problems. Obviously, how susceptible you are. How good is your nutrition? What's your age? What's the status of your immune system? Has that been compromised due to dysbiosis from yeast or from Clostridia? Have you been exposed to heavy metals? Have you been exposed to a toxic burden of other environmental toxicants, such as glyphosate, which, as many of you may know, alters the gut biome and promotes Clostridia and yeast and Aspergillus overgrowth in the gut? So all of these tend to superimpose on each other and to be synergistic in, unfortunately, a bad way. So how about our new test? Our current test has 11 mycotoxins that you can see here on the left. I know Jessica mentioned 18, but we actually have 20 that are going through validation right now. We're not 100% sure that every single one of those is going to make it in, but we're pretty sure that 18 are going to come out the final end. So you have to wait a little bit more time until we can give you a definitive answer, but you can see that we're vastly increasing the aflatoxin class from not just AM1, but also B1, B2, G1, G2. We're adding 2 in the T2 and the HT2 toxin class. We're adding 2 relatives, ochratoxin A, ochratoxin B, and C. And in terms of zearalenone, which is, remember, a very important xenoestrogen, we're looking at its metabolic products. And it turns out that alpha zearalenol is actually more potent than zearalenone itself on the estrogen receptor. So important to see if one is being exposed to that. So what are the specifics of our new test? Well, we have a greater number of actionable mycotoxins that affect a wider range of target organs. I'm very excited to tell you that we have a brand new reference range that spans ages 6 up to 92. Just as an aside, the 92 is my mother-in-law. She very kindly donated her sample. We've totally redesigned the assay and validated it from the ground up. This continues to be a LCMS-based assay with very advanced extraction methodology on the front end. We're very proud and pleased to say this is an ultra-high sensitivity, ultra-high specificity assay. In contrast to prior assays, this is not affected by concurrent treatment with mycophenolic acid-derived immunosuppressants. So you can be on Myfortic or some of these others and still measure your mycophenolic acid. And remember, if you are immunosuppressed by that drug, you actually have a higher probability of being colonized by other opportunistic organisms, including yeast and fungi. So that could include those that produce mycophenolic acid. So it's a better, more sensitive assay. So we can use smaller sample volumes. It's more robust in terms of its ability to just keep going around the clock. And as a result, we anticipate rapid turnaround times. So my colleague, Jasmine Brown, one of our star clinical consultants, is quoted as saying, treating mycotoxins is not a straight line. This is a very nice figure showing that, whatever the mycotoxin is, it can impact multiple organs. The biggies here are, aflatoxins, liver is a carcinogen, T2, which has reproductive and digestive effects, ochratoxin A that affects just about everything, including your immune system and your kidneys, and the zearalenone, which again are a xenoestrogen and can have reproductive and endocrine effects. So this is another way to look at our world of mycotoxins and how they impact separately and synergistically the organ systems of the body. So one of the watchwords of functional medicine is one condition, many causes, one cause, many conditions. And here you can see how that applies to mycotoxins. And again, I want to emphasize that these coexisting conditions to impair your bodily integrity, your body's immune system, and also the gut barrier and the blood-brain barrier, they all synergize to cause problems. So this is just another way to look at our new markers and the various organ systems that they affect: the liver, the kidney, the immune system, what's carcinogenic, what causes GI problems, those that affect our neurology, reproductive health, our lungs, and our reproductive and otherwise hormone homeostasis. Remember that allergies to molds are different than mycotoxin toxicity. So that's always a bit of confusion. So I just did want to point that out again. So I'm all done. Thank you very much for your attention. I hope I haven't gone too much over time, and be happy to entertain any more questions. So thank you so much.
Thank you so much, Dr. Stein. That was incredibly thorough. I was actually enjoyed from start to finish. So I really appreciate you just breaking everything down and also going over some of the oat markers, because I know that's something that with so many parents, they run oat after oat and kind of get lost a little bit. And so I think that this will be super helpful for people to go back and look at kind of you hitting those markers and saying, hey, this is what's going on. So thank you so much for that. And can you let us know, before I forget, when do you think you're going to have your new mycotoxin 2.0 test rolling out?
Well, just as soon as we can manage, but certainly by the end of the year.
Okay.
So that would be very conservative. We're in the throes of our validation procedures right now. Again, we've spent a lot of time and effort developing this assay. We're extremely careful. I have the pleasure of working with my colleague, Dr. Edward Rogotsky, who is one of the world's best analytical chemists. And we're very proud of this assay. I mean, our current assay is certainly a very good and solid one, but this one just takes it to the next level.
Yeah, I'm very excited to be ordering one as soon as it comes out. So thank you for that. We definitely had some great questions come up. I kind of wanted to ask you one in terms of treatment, because again, so we're obviously talking, no one's talking about specific dosing or anything like this, because that's definitely a check with your practitioner. But in terms of this new test rolling out, and then let's say you have a kiddo who has some mold markers are high, definitely gliotoxin and ochratoxin A are, from what I've seen, are the two number ones, I would say, things that pop up for kids when we were running the old MycoTOX test alongside their oat. So what are your thoughts on treatment? I know that when you were going over your different case studies with some adults, it was about like 3 months. So when do you think in general is a good time for treatment and then retesting to see where you are?
Right. Well, when it comes to aspergillus, the drug of choice would be itraconazole. You can certainly use certain herbal formulations, which some people have good success with. You want to break up the biofilms, things like biocidin, I know, are very popular. And some people do well with probiotics. So Boulardi, that kind of thing. Again, 3 months is a very reasonable time frame, and I would be guided by symptoms. So if you're doing very, very well, you seem to be improving, you might delay it to 6 months. If you think you're making some progress, but you really want to get a handle on how things have improved, I think 3 months is pretty much the standard. So somewhere in that area, around 3 months. I don't think there's any need to do it 6 weeks, although, as I showed in that one case report, in 6 weeks, there was a dramatic improvement. And they retested, but unless there's a super dramatic effect, I wouldn't check that early. When it comes to gliotoxin, which potentially would be from yeast to overgrowth, again, you'd want to treat with nystatin or potentially also, fluconazole, itraconazole. Again, the nutraceutical supplements are very good. Again, breaking up that biofilm is absolutely important. And binders are very, very good at sopping up these mycotoxins. And the other thing, and I just sort of passed over that, but it's important to detox your mycotoxins. So they undergo classic detoxification pathways. First, they get conjugated to glutathione. Then they undergo phase 1 and phase 2 detoxification. And ultimately, they get conjugated glucose or sulfate, and that increases their hydrophilicity, and they're excreted in the urine. So having robust liver-based detoxification capacity is absolutely essential. I think everybody here realizes that. So everything from supplementing with either high bioavailability glutathione or maybe NAC as a precursor, making sure that there's enough selenium. as well as the other vitamins that go into those pathways, make sure methylation pathways are up to speed. So very important though. So having intact detoxification, I can't emphasize enough how important that is.
Absolutely. And then when it comes to, obviously, you were mentioning about, mold is very immunosuppressive. Oh, hello. My phone is having a party. Is very immunosuppressive. So basically, what would be your thoughts on the immunosuppression of mold? So if you have, because, there seems to be this correlation, obviously depending on the mold species, but with mold and yeast, and they like to have a party. And so usually you need to kind of hit both. Itraconazole is one of those great ones that hits both of those when you're dealing with aspergillus and with, arabinose, with like candida, basically, which is that seems to be a big issue in kids with ASD. And so, what are your thoughts on trying to keep that? Basically, my question is basically like proper treatment. Do you think you would be able to see something like, is that immunosuppressive nature of that mold? Can you get rid of it? Do you know what I mean? It's kind of like this whack-a-mole
Well,
game.
it's as I think you're pointing out, it's a vicious cycle.
Yeah.
So the more immunosuppressed you are, the more the chance you're having an opportunistic infection, be it aspergillus, be it the toxic yeast. Just regular yeast colonization is benign, but it's when you start getting invasive yeast that the gut is really that gut blood barrier, if you will, is being broken down, and you're now absorbing toxic substances. You're absorbing food peptides that you shouldn't be, that should be otherwise broken down. So that's going to induce a immune reaction. And we know that effect, which goes in the gut, is also probably happening in the brain. As they say, brain on fire, if you've got a lot of yeast growing there. So I'm certainly not an expert in autism, although I'm learning very fast, but I do understand that food intolerances are extraordinarily important. And again, these feed back on themselves. So this dysbiotic gut will go along with food intolerances. So you want to identify and treat both simultaneously. So elimination diet, GAPS diet, whatever people prefer and are comfortable and knowledgeable with, but it needs to be a multifactorial approach. I don't want to imply it's only treating with drugs or maybe supplements. I think you need to take a look at the whole person. And that's why I love functional medicine.
No, absolutely. And thank you for that. We have a question from Claudia Juarez. She said, great talk. She said, what about glutathione patches? Do they work?
I don't have experience with them, so I really don't want to say. I just have experience with liposomal glutathione. There's also the acetyl glutathione that you can get in slow release formations, packaged in cyclodextrins. So they're slow release, they're high bioavailability. The liposomal glutathione is obviously being absorbed directly through your mucous membranes, but is more shorter acting. They both work. I've both used both. I used both during COVID and seem to do well by them. But unfortunately, I don't have much experience with the patch. Sorry, can't.
No worries.
Can't comment.
Just wanted to throw that out there because I actually don't know the question either. I don't know the answer either in terms of, I always think of it like liposomal going into the mucous membrane. So would it work with a patch? I'm not a doctor, so I couldn't tell you. But yeah, it's a good question. Another question from Monel Shah. She had asked regarding, have you seen, or maybe in clinical practice or in case studies, any like peeling of the feet or hands due to mold? It's kind of an interesting question. I'm not sure if you've seen that.
I mean, certainly if you have eczema, I mean, that's one of the allergic conditions associated with ASD, right?
Mm-hmm.
So that would be a flag that there is immune dysregulation going on. You can certainly have onychomycosis is the medical term. So you can get yeast under your nails. Mm-hmm. So that would imply that there is yeast overgrowth. If somebody is not a child, if you're obese with metabolic syndrome, it's not uncommon in patients who have diabetes. And again, the things that make metabolic syndrome worse also make your predisposition to autism worse. So in other words, a high toxicant load. So you've been exposed to BPA or high levels of glyphosate, atrazine, things of that sort. Those are going to impact how insulin sensitive you are, your mitochondria in some cases, your predisposition to gaining weight. And again, it's going to impact the robustness of your immune system. Immune cells need healthy mitochondria just like everything else. So if they're not on the front lines fighting, and if your blood sugar is high, it's a party for the fungus to just sit around and eat all that glucose that might be in your interstitial fluid.
Absolutely. And I just wanted to say on a side note for Manal, because I'm not sure, there's not a lot of information, but if this is a kiddo we're talking about a child, and we're talking about a child that is ASD, you also could look into with the peeling hands and feet can be a strep situation.
Right.
Yeah.
Right.
So maybe just on a side note, I just wanted to throw that out there. Maybe talk with your doctor and check for strep titers on that. Let's see. There was some more good questions. Somebody was talking about chronic fatigue syndrome. Have you seen any association with mold and chronic fatigue syndrome?
Absolutely. So again, there can be effects on multiple levels. So again, there can be mitochondrial effects contributing to chronic fatigue. There can be neurologic effects contributing to fatigue, somnolence, poor sleep, depression. And again, the dysregulation of the immune system, which probably also plays a role. And they're that's very well established in the literature. I didn't have time to go over the data, but chronic fatigue syndrome is associated with mold and mycotoxin exposure.
Absolutely. I know I feel like I've read a bunch about that as well. I don't have any things to post at this moment. Maybe I'll ask Enrique. He's always my brain of everything. Now, Donna had a great question. She said, can molds, mycotoxins, etc., cause gastroparesis? If so, do you recommend that gastroparesis patients get tested for these? And how do you go about doing this? I'm assuming we're going to go.
That's a very interesting question. I think the answer is yes, but I can't pull a reference out of my brain banks at the moment. Certainly, we know that if you have coexistent diabetes, you can have an acquired gastroparesis. So if you have coexistent hyperglycemia and mold exposure, and of course, those will feed back to make each worse. So if you can both get rid of the colonization and improve the glycemic control, again, instead of getting into a feed backward vicious cycle, you're going to get into a positive feed forward, if you will, good positive cycle. So one would want to hit it from both ends. I think it's a mistake sometimes to think there's just one magic bullet. I think we need to look at the multiplicity of things that are going wrong, and which is why a healthy diet, a toxin-free diet, and ideally an allergen-free diet is sometimes the best.
Absolutely. All right, we're going to take 2 more questions because I know you have things to do. We have a good question. It's very specific, but because I know people. So Ken Lassison is actually one of our. He's incredibly intelligent when it comes to the work he's done, like citing which bacterias do this, etc. So he had a good question that maybe you know the answer to. I don't know, but he says, has anyone tried the probiotic Aspergillus? Or I'm going to spell it Oryazae or Zay to displace the bad sibling, i.e. strong Wakamoto W from Japan. So I think it's almost like giving, this probiotic, which is Aspergillus, but then to crowd out the other. Thoughts on that?
Yeah. I vaguely recall hearing something about that, but again, I can't say specifically. So I don't want to obviously make anything up. Clearly, you can give probiotics, C. Boulardii, and that can help restore normal biota to the gut.
Yeah, I think that when it comes to really specific things, there has to be tons of testing and then data collection and everything. So it's difficult. I just figured I would try to just ask you.
It's a great question. I'd be interested to know the answer.
Me
if
too.
Somebody has it.
No, me too. Absolutely. I'm sure actually Ken might find the answer one day. So another question that could be interesting. I'm not sure if you have any data on this, but when you're citing genetics, which obviously play a huge role in so many chronic diseases and so many chronic syndromes, do you have any idea of any SNPs that are associated with any of these, or that have jumped out to you in your research?
Well, the biggest, of course, is MTHFR and the importance of the methylation pathway in terms of autism and some of the neuropsychiatric effects. COMT is very important. There are others. Dopamine beta hydroxylase, I believe, has one. Again, they exist. I can't pull them off the tip of my tongue other than those three. So I will say that epigenetics, remember, is an overlay on your genetics. So you can have a predisposition, be heterozygote on something, and epigenetics, which is really the effect of your diet, the environment, toxins, food, glycemia, etc., can have important effects on gene expression. So increasingly, we're seeing that as an important effect.
100%. And I think that's something that we all have our SNPs. There's, like you're saying, and it really does just depend on, you can do the best you can with all the knowledge we have, because is it expressing at that time? Is it not expressing? This also plays a factor. So definitely not, I have this, MAO, positive, and then I just can't do anything about it. You totally can with all, with everything you've mentioned. So I want to thank all of the people that commented as well, because people woke up today and came with their hard questions as opposed to just general questions.
Well,
So I
I
do
thank your
appreciate that.
audience so much.
Yeah, we had some incredibly intelligent people come in today. But thank you so much, Dr. Stein, for joining us, for giving us a ton of information. If we are people able to reach out to you directly, or just through Great Plains Lab, or
Sure. I'm happy to give my email address. It's dstein@gp-labs.com. I should have put that on the slide. Sorry about that. But anyway, I'm certainly available. And Dr. Shaw is still around and available. I consult with him regularly, which is lots of fun. But I certainly am available as well.
Okay, wonderful. Well, you're going to have a blow up of emails in your inbox, I believe. But thank you so much for joining us today. Please keep us posted on your newest test coming out, because I know a lot of people are going to be super interested to see that, Absolute 2.0 come out and really break down everything that you guys have done, work hard to find. So thank you so much. Have a wonderful weekend. And hopefully we can have you on again soon to discuss the next, like what you're seeing in the 2.0.
Okay. Well, I look forward to it. And we're already planning some partnerships with people to do all sorts of great research studies. So anybody with a good idea, by all means, please contact me. We'd be happy to entertain it.
Amazing. Thank you so much. Have a wonderful weekend.
All right. You too. Thank you so much.